Thank you very much. Well, firstly, I'm really honoured to be invited to speak today. I think I'm the only one that's not in the national media, like a number of our presenters today. And I'm going to give you a background. I'm a chartered accountant. I'm in public practice, so I sign tax returns. Okay? I'm a certified practicing accountant as well. So do you know what those names mean? Have you heard of chartered accountants? Yeah. Have you heard of CPA? Yeah. Okay, good. I'm going to bring you back to that in a second. Now, so I'm the CEO and founder of Health and Life, and I basically have specialised in one area, healthcare, in Australia. And yes, I do have a few letters next to my name, because if you want to front up to a doctor, you have to show you're qualified. So I just put a few there just to keep them all occupied with that. Okay. All right. I've been doing this for 25 years. Okay. So I've had a long stint at it, watching all of you. And I'm an observer, by the way. Okay. Look, in my previous life, I was a corporate auditor at a Big Four called KPMG. And yes, I'm from Adelaide, and yes, I was there, and yes, I was on that job when the bank collapsed, and we had a Royal Commission for free. Okay. I've worked for GPs, specialists, public hospitals, private hospitals, pharma, state and federal governments, with national consultancies and universities. And these are all by accident, by the way. It wasn't sort of a grand plan. I've been a national financial analyst for the National Primary Care Collaboratives, which is funded to the tune of about $45 million. It was a longitudinal study in primary care, seeing how we could actually use our nurses to basically have a more sustainable practice and have better access to doctors within 2 working days. I've also been what is called an Australian General Practice Surveyor, which basically means I can go in and do a Bowie Dick test in our medical practice and see whether you're sterilised or not, as much as signing a tax return at the same time. Now, there's no accountant in Australia I've found yet that can do both, and I'm ready for the challenge. And I had been doing that for about 10 years. So I've been looking at the operational sides of your practice as much as the strategic issues and the big public policy health issues all at the same time. We can walk and chew gum at the same time. And I have served on some national boards, and one of them is the Australian Association of Practice Managers, which actually specialises in the healthcare industry. And to me, practice managers are pretty important because they're kind of like the control tower. For the airport, they're the ones that are seeing what's going up, what's coming down. And a lot of practitioners work in silos, and the only hub in the wheel is the practice manager, or the CEO, the hospital administrator, who gets a real good top-down view. And I've also served on public boards as well, like Netball SA. We'd won have you heard of the Thunderbirds? Yeah, I was on the board there, and I got the pink dresses up, so that was my time. And we did very, very well, and won a couple of premierships after a long drought. And I'm also sitting on some private foundations. I'm very big on health and financial literacy for kids, and I'm very much focused in that area, in the adolescent area. And also, with due respect, I don't use lawyers much. When I do my work and I've got a problem, I spend a lot of time with the media. I've done probably 350 media interviews nationally. Australian Financial Review, Medical Observer, Australian Doctor, and it reaches, nearly all GPs every week. And I'm very open and transparent with the things that I say, because if I get it wrong, that's the best way to market test myself, to be open and transparent. And I'm the brown sheep of the family. My late father was a psychiatrist. My in-laws, my mother-in-law was a specialist pathologist, wrote a few books, international books, and worked in the public sector and trained up half of the med students that are practicing in South Australia. My father-in-law was an anaesthetist. Now, these comments I'm making, I'm not attributing to what they've told me, but I've grown up in basically a family of medicos. This is all going to become quite important when I go to the next slides. Why am I in healthcare? I didn't want to be in medicine. I actually wanted to do the whole Wall Street corporate thing. And then within 6 months, it was on June, I worked on a Tuesday night until 5:30 in the morning, and I crashed my car into a tree after work, 5 minutes away from my work. I fell asleep at the wheel. I was exhausted. So after having that experience, I got 9 operations, 4 years of rehabilitation. And I realised to myself, there's no point in being the richest guy in the world. And I didn't want to work for the Wall Street anymore. I just want to work for the man in the street. I was frustrated with my healthcare, despite the connections that I had My family pedigree is not exactly one that would not know people. It's not like we didn't have access to money, but as a patient, I was totally disempowered. Totally. And I'm even more frightened to get sick today than when I was back then. Okay. So what's the suggestion box about? So I decided that we have a mission statement called Creating a Sustainable and Socially Responsible Healthcare System. That was my big mission, and it wasn't to fix up just a practice but the entire healthcare system, because that's what I worked out was the real problem back then, back in 1992. Oh, 91. And anyway, I had some clients, and in my earlier years, the first thing you do to be a good consultant, you get feedback. And I had this little suggestion box, and I put it under lock and key, put it into one of these marquee practices, well known. And anyway, within a week, I get the feedback and the suggestion forms, and boom. I'm going, uh-oh, we've got a problem here. One of the doctors, very influential, was doing a bit more than checking out the sore throats of female patients. I think you get my meaning. Now, and that was not just one female patient reporting, it was many in a 1 week period. So I'm thinking, there could be a problem here. And I went to the actual director and said, look, we've got a problem. And the director said, well, actually, we do know about it. Why won't you do anything about it? Here I'm thinking I'm going to get fired. You know, I'm sitting here trying to have this great new consultancy, and guess what, I'm going to get fired. And the response was, look, David, we don't know how to handle it. Can you handle it? I said, hang on, I'm your account, your advisor. It's not my job to sit there and get involved in clinical matters. So I said to them, I made a suggestion, look, listen, why don't you just show these results and, you know, let them know, look, we're not accusing you of anything, but, you know, perception's reality, and maybe could you give me about 40 grand so I can, you know, get a chaperone nurse or somebody in there just to make sure nothing happens. But I wasn't still happy with it because, you know, people's DNA are people's DNA, right? I'm no doctor, but, you know, people are wired in a certain way. But I thought, look, I'm going to, you know, I come from the free market, freedom of choice world. Let's put my economics hat on. What would I do? And I looked at what all the female patients said, and they said, look, we just want a female doctor. It's a brilliant idea. So I go out there, and it's very, very hard to find a tears and smears, you know, practitioner, but I found one. And I thought, gee, I should be consultant of the year for solving the most complex, you know, medico-legal, ethical problem. And it was hard, okay? And it was embarrassing for people, but I made it sure to keep the whole process discreet. We just had a problem, we had to deal with it discreetly. Anyway, that was all working until 6 months later. She gets a phone call from Medicare. You're over-servicing too many pap smears. I'm going, what? Oh, well, the average male on a normal distribution curve only sees about 4 a day, but this is a subspecialty clinic. It's hard enough to get these women to turn up, let alone find somebody who's going to do something about it. And come on, are you crazy? He says, well, look, Dave, I said, well, who are you people? Were you accountants? Because we are. You're not practitioners. No. Well, okay, good. Can we kind of look at this properly and look, do you do any profiling? Well, no, we don't. Look, David, let's keep it simple for you. How about you just ask your client to look at maybe rolling over, pay back 50 grand, and we'll just let the matter go. Well, otherwise we're going to keep taking it through this new professional services review stuff. And I'm going, oh my God, I'm a taxpayer, and my money is supposed to be used this way, and this is what's happening? This is ridiculous. And how do you think I feel as a professional advisor, feeling like, oh my God, David gives dodgy advice about how to set up clinics? So my own integrity was getting challenged as well. So the whole thing was ridiculous, and guess what happened with the pap smear clinic? We ended it. Audit fear anxiety just takes one phone call. Works really well. Anyway, this thing kept going on, and as my practice grew around Australia, I got more clients around Australia, didn't I? And then the same thing happens again. I'm going, hang on what right? And how does the government sort of make these calls? Where's the clinical justification for all this over-servicing? Are they really interviewing these people? Anyway, I got one of my staff members who was studying law at the time. I said, can you go and search up some information and find out what is the legal position with regards to can the government interfere in the doctor-patient relationship? And the government, the answer came back, and this is from a High Court judge, a Chief Justice, right? So this is the highest court in the land, and it said that the federal government cannot interfere in the doctor-patient relationship. And I'll show you the proof of that very shortly. Okay, and this is why you're having all these problems. Okay, and this plot will start and thicken, and you're going to see exactly what the problem is. So I thought, oh wow, so I wrote an article, and because I happen to have a lot to do with the medical media, and guess what? Everybody starts emailing me, the leakers. I had all these leakers saying, look, David, I just want you to look at this. And I was doing this pro bono because I was just upset. I said, this is not the way my taxpayers' money is supposed to be spent, A. B, what if it's at my daughter? What if it's at, my wife? This is not right. So this issue was personal to me, thinking, oh my God, and every time a female patient went in, I would just shake my head, not being able to do much about it. So anyway, I thought, well, we've got a problem here. And so this audit field anxiety, this started up in the press, and that was obviously, and I've got to disclose, obviously my name is associated with a number of these national press releases, because I was actually trying to bring the media's attention to it. And obviously, people contacted me. There is also this other thing here you need to be conscious of here, is that when you're obviously getting that sort of media attention, people start to give you evidence and you start to see a really big pattern. And the government doesn't know who I am, because you know why? I don't own medical practices. I don't sit on government boards or corporate boards for a reason, because I believe in freedom of speech. And the government's rules that if you sit on boards, you can't speak. So I actually decline board invitations all the time for a reason. And anyway, as I was progressing through this, I actually went and looked at the APRA rules. And this was an interesting one I found when they were introduced, when you had the National Registration System. And it's section 1, it says at 86.2, and it says, a panel is required to observe the principles of natural justice, but is not bound by the rules of evidence. All of you, doctors, nurses, pharmacists, all of you can be prosecuted without evidence. Did you know that in this country, in our constitution, due process is a constitutional right? And I wish my QC friend Tony was still around and he could just elaborate on this point. Okay, what this basically means, you can't have people speculating on you, and they need actual evidence. A lot of these audits, they weren't even ringing up the patients, they had no evidence. Okay? And this is fact. So I was questioning these prosecutions, these Medicare overservicing prosecutions, pro bono, just trying to get the answer. And anyway, I got one of my journo friends to ring up the Royal Australian College, this is all the national bodies, the Royal Australian College of General Practice, the Medicare Australia, the CEO of Medicare Australia, the National President of the Australian Medical Association, and there was a federal government body called the Australian General Practice Network, which supposedly represented everybody. It was funded to the tune of 300 million. And I asked one simple question. Who is responsible for interpreting these Medicare numbers? And guess what they all publicly said? It's not us. I have one article, and they all denied responsibility for interpreting the MBS. And then I started asking myself, then how do you prosecute somebody when there's nobody in charge of interpreting, A, what those standards are, let alone, are there any standards? And that's the next question I'll put out there. On what basis do you prosecute people in this country? And I'm sorry, I'm an accountant, and we have different rules. I'm shocked to see your rules, totally. Now, this is what you're really up against. So when we look through that, I said, well, this is wrong. Anyway, I thought we'd just take it up another notch, because all these people had written to me. I said, well, listen, guys, it was called the Australian Doctors Union in 2011, said, let's go and get 1,200 patients to say, let's run a Senate inquiry, a PSR inquiry, to look at whether these prosecutions were valid. Okay? And at the same time, there were these federal court cases on exactly the same issue being held in the federal court outside the tribunal. It's a bit, outside APRA, a statutory body. So this is in the real courts of law about these prosecutions. And the timing was impeccable. We get our Federal Senate hearing. We get our time. Our 5 minutes of fame on the microphone. If you want to find out, I'm in the Federal Hansard with a few people. And the AMA were there, all the medical defence associations. This was a national federal inquiry into this matter. And they went there, they listened to us, we gave our recommendations, and I made a couple of mine hit there in the final report, Senate report. And at the same time, what had happened was a full bench of the federal court had found, it was a Kootloo case, and what they actually established was that all these prosecutions were not valid and 77 cases that were being investigated got dropped. Okay? So anyone going, wow, this is getting really awkward. So if those cases got dropped, what about all the other cases where there have been quiet negotiated settlements? Did they have natural justice served on them? And this is a full bench of the federal court, which basically overturned the PSR, Medicare's decisions, these internal tribunal statutory decisions. Okay, you getting the picture? Okay, there's more. So that was going on, and around the same time, the government then said, all right, well, we've got a problem here. Now, as you can follow, our health ministers were, who? Nicola Roxon became a federal Attorney General when there was changes in government, you know, with Rudd and Gillard, remember that bit? So she became a federal Attorney General, and Tony Abbott was in the opposition, and he was vying for what? To become our next Prime Minister. Okay? Well, it's a bit of a problem because in the press, the media press reported that this particular matter about these invalid actions were now going to go to the High Court. That these two ministers did not get any medical oversight. They're supposed to have this agreement, I haven't found it yet, where the AMA oversees the appointment of the appropriate clinical representatives, and therefore all these prosecutions weren't valid. And what happened? Well, if that went there, they would have been up on criminal charges. Some of the most high-profile politicians of the day. This wasn't meant to go this far, by the way. This wasn't the grand plan. This is just what was unfolding. Anyway, a few months later, it comes 30th of June, and there's a bill before Parliament with full bipartisan support, hardly any debate and discussion, and quietly, what did they do? They passed a bill, and they retrospectively made all those invalid prosecutions valid. Okay? Then what happened, and I've got all proof of all this stuff if you need to read it, if you need it. And then what happened was I actually made my assertions, and I made an accusation about the entire healthcare industry in my Senate submissions, and I said, none of you have any commonly agreed clinical standards. Okay? And that's what your problem is. Because that's what's breeding the bullying, that's what's breeding the egos, that's what's breeding all these really closed-door, non-open jury type of decisions that you don't have any idea. And then what actually happened at that point, and by the way, this is actually where they reversed, where they did the retrospective funding there. So when they did this, I thought, oh my God, the very people who are supposed to govern are not governing, they're covering. And there's a real big difference. Okay? When I made that statement, a year later, this guy, I don't know if you've heard of him, his name's Professor William Runciman. Now, Professor William Runciman is, the president of the National Patient Safety Council. And I met up with him last week, and I said, look, Bill, I kind of need your help on this particular matter. I know that when I actually made these allegations, I was a bit of a lone wolf making a big statement. But I noticed you wrote a research paper, and you said exactly what I said, but you haven't been able to prove it. And what he had said in the paper was like 50% of routine GP consults were suboptimal. There are no commonly agreed professional standards in the country or basically in the world. In the world, you're all working in silos. You have guidelines that most of you don't follow. There is no, your access to this information is not widely known or widely available and easy to access, and it's not practical to implement. Okay? This is the problem you guys have got. So I'm just trying to define the problem. Okay. And by the way, he's read this whole paper, and he's just given me this morning a full letter of support to this paper. Not only defining the problem, but also the solution that I'm going to give to you today as well. And I mean a real solution. Okay, well, let's keep going. This is the solution. Okay, it might be a bit hard to read. What this is, and I'll explain it here. Here it says International Healthcare Standards and Ethics Board. You establish one, an international one. Not a national one, an international one. What it has components, key components, is a standards and ethics component. It has a compliance component, how to teach and course content component, innovation and research component. It has a DRG coding and non-clinical practice component, how you run your practices that are efficient and effective. That is best practice. Then what you do is in each country, you will actually have a local standards board where they actually customise it, tailorize it to that local regional area. And we call that, let's say, for example, an Australian Healthcare Standards and Ethics Board. And what does that do? Well, it represents medical, allied health, hospitals and community, healthcare CEOs, practice managers, pharma, established emerging industries like e-medical, e-health, universities and research and teaching, how we do that and establish that in an ethical way that is not sort of pharma-sponsored. Yeah? Okay, it studies things like population health relative value studies. Are we getting value for money? Okay, and what you can do, and this is how you get rid of bullying, which is the big theme of today. You can actually have competing colleges, like we have here, the Royal Australian College of General Practice, and an ACRM, which is a rival body where if you want to become a GP. So if you're not happy with one body, you can go to the other. That's how you get rid of bullying. It's called competition. And the consumers are at the top, and what's the best funding models of healthcare? There's also an international research group on that, so we're not duplicating our research. Now, I'm going to be real quick here because I'm getting a wind up. This thing is self-funded, by the way. There's not 1 cent that's coming out of government. Okay? Will it work and will it ever work? This sounds like pie in the sky. As Professor Bill Runciman said to me, David, your dreams are grandiose. It's not possible. Guess what it is? Guess who's doing it? Us accountants. We've been doing it since '73, people. Okay? Because we had so many scandals in our own industry, we had to do it. And it's in 130 countries all signed up. All meetings are open and transparent. It's held in public. There are webcasts. Everybody can challenge it. There's international accounting standard boards, interpretation committees, and they feed down to the local regional bodies. There are 130 countries that signed, and even America signed. Why do we have the global financial crisis? Before anybody starts telling me, well, that didn't work, did it? Okay? Because America decided not to sign up to all of the standards, and they pay the price. Okay? It's called the US GAAP. You can go and Google it. So you put out exemptions, guess what? If you get any of these special religious exemptions, you get into a lot of trouble. Plus, it's probably not a good idea for government to be sitting there and owning banks and offering cheap rates when you already had enough banks doing that anyway. So, government should govern, and they shouldn't be sitting there competing with private enterprise. That's how you keep the accountability. So you can see, we've got this International Federation of Accountants. How does it work locally? From a practical point of view, because that's all big pie stuff. How does it affect me day to day? Day to day, I had this issue on an account the other day. A new client comes up to me and says, we've got an ethical problem. Our accountant is my personal accountant and the group accountant, and we've got a dispute on. I said, well, you know what? He's on the tax agent board, which is like your APRA board. I'm a registered tax agent. And guess what? The tax agent board here adopted those international standards. I said, flick that to him, we could lose his licence. Guess what? That was done in less than a minute's phone call. No investigations, no inquiries, just reminding everybody where they all stand. I love my memberships, and I'm a member of both Institute of Chartered Accountants and CPAs for that reason. When we have disputes, you're going to have them, but these ethics boards have been fantastic, cheap, cost-effective and fast. It takes one phone call, things done. I've been dobbed in by my competitors. In fact, the ethics board said to me, Dave, you're doing such a good job, that's why they're complaining, because they're losing all their clients to you. But that's nothing against the rules, you're just good at what you do. And the matter was closed. No lawyers, by the way, none. And that's where you deal with those shades of grey areas. Okay? So, by the way, this stuff works. And we do this when we're doing taxation rulings. There are joint committees. So what's the benefits? On my last slide here. Basically, that it does increase clinical and consumer sovereignty and trust in the system. And that's what you guys are losing at the moment. We're arguing that doctors are greedy. We're arguing corporates are greedy. And we're all justifying why we've got the high moral ground on all these issues. But nobody has anything to base that against. You have nothing to base it against. You're going to become more public and open. You can have real-time and uniform policy development. So if the Zika virus gets out, guess what? There's an easy way to get that into practice. There's programs now, your practice manuals can be updated automatically and globally these days. So these things can make life easier. I get what's called accredited every 5 years. And if I don't pass, I will get accredited 3 years or 2 years, depending on how bad I am. And they fly a peer from Queensland to my practice in South Australia, and they go through my books. And it's blind. Okay? So there's no biasness. And that's how it works for us. And it's not an embarrassment. I really appreciate it. It's good to get an external feedback on what I could be doing better. It's not a threat. Never have had a problem with my professional bodies. So the reality is you can do things and develop more clinically relevant research and not sort of be competitive research. You know, there's a lot more money out there, and it can be really specialised units. The other thing you can do is all this e-health. In South Australia, we've got this great big e-pass system which is hitting the papers at the moment. It doesn't talk to our new national system, which we spent, 10 years and $2 billion, and we've spent hundreds of millions of dollars in South Australia. Because why? Because the coding, there's 8 digits in South Australia and there's 10. You know, and therefore they don't talk to each other. So it's like trains where you've got different rail gauges. Until you get a common framework and a system framework that you can all talk to, only then can you start truly innovating and developing. Okay? So that's one of the major benefits. And you will reduce lawsuits. You reduce bullying, intimidation, duplication, and wastage. You will reduce this argument where corporates are coming in trying to commoditise profit before patients. You are letting them in because only you people can speak. It shouldn't be your accountant speaking up for yourselves. It's your profession. Okay? I'm just standing here on the outside saying I can see what's so wrong here, and it's so easy to fix with one shared vision for the entire industry, not just in Australia, but internationally. And you'll get rid of these political vested interests, because you know what the government loves the most is where the votes are. There's 3 reasons why you get elected. Now remember this, some senior politicians tell me it. First one's unemployment, second one's health, third's education. If you show yourself regulated and you can look after yourselves, it takes a thief to catch a thief, guess what? It's no longer an election issue, the government's going to love it. And you'll get rid of all administration bureaucracy, you'll save them a whole lot of money on compliance and regulation. It's just too hard for them. And your peers at the coalface are going to be self-monitoring in your groups. And I'm not talking about setting up new agencies, it's adopting existing structures and agencies, but just having one talk point. We're not about reinventing the wheel. And all these corporate commercial interests, ethics boards, there's ways you can have nomination councils to stop conflicts of interest. And by the way, this constitution's already been written up, so you don't even have to do anything, you just steal, take it, it's there. So it's not hard. The overall objective to government is say, listen, we can show everybody's at zero, but guess what? The cost of healthcare are going up, but they're going to start to decline, and this is a quality index and a price index. And actually proving and showing to government we're going to do well. Okay, we've got this. We've got it controlled. This is not hard stuff. So, I just like to make a few acknowledgements. Yes, certainly, to Professor Bill Runciman, and for his letter of support on this project. He's like I said, he's in the Medical Journal of Australia. He was being the most cited professor in the last 100 years for his work in 2012 and 2014. These people are the establishment. So the establishment want this as well. Okay, so if you think you're on the fringes, I don't agree with you. Okay, I've just come from those offices only last week. And I actually went to school with this guy and grew up with him. Honourable Christopher Pyne here, he's the Federal Minister for Industry, Innovation and Science. You know this is an election issue, it's an election year. They want to see innovative things. I believe Australia can be the Silicon Valley of healthcare in the world, with world best and international best practice. So what do we do from here? Send me an email, letter of support, share this information with other people. But it's really easy to get this up. I know it looks hard, but it isn't. I promise you. We've just got to start talking with each other.
Thanks very much, David.